Thank you everyone for joining. For those of you who might just be tuning in now again, I'm Jevin Britta. I'm the physician assistant with the Yale Survivorship Program, and welcome all of you to our Smilow Cancer Network Smilow Shares event, the Survivorship Series for National Cancer Survivors Day virtual celebration here at Smilow Cancer Hospital. We're hosting this month-long event to celebrate all of our cancer survivors across our wide network here at Yale. And we're doing our live webinar series, our last one of the month tonight until about 8 p.m. And we can certainly go a little bit longer as time permits. But we want to be mindful of everyone's time as well. So as I mentioned, to kick things off, I'm Jevin Britta. I'm the physician assistant with the Yale Survivorship Program. I'm going to be just talking a bit here tonight, helping go through some of the questions, but the stars of the show are here with me. Our panel for the Smilow Shares event tonight, Holistic Coping Strategies for Cancer Survivors. And I'll start by having them introduce themselves. Go ahead, Dr. Feyen.
Hi, everyone. Thank you for coming tonight. My name is Dwayne Feyen. I'm a clinical psychologist on faculty here at Yale. I've been here for almost 30 years, and I've been working at Smilow since it opened in 29. So that's thank you again for coming. I look forward to sharing a little bit about what I've learned about coping and resilience.
Thanks so much, Dr. Feyen. Go ahead, Dr. Kilkiss.
Hi, I'm Jennifer Kilkiss. I'm a clinical psychologist, and I've been with Yale a year on Thursday, so not nearly the length as Dr. Feyen, but really excited to be here and help share some strategies to help cope.
Thanks so much. Go ahead, Ed.
Hi, everybody. Thanks for joining us all. My name is Ed Schwartz. I'm the outpatient palliative care social worker at Smilow Cancer Hospital. And I too, as Dwayne, Dr. Feyen and Dr. Kilkiss said, am excited to be able to share some information with you. So thanks.
And go ahead, Angela. Thanks, Ed.
Hi, good evening, everyone. My name is Angela Corrala. I am the clinical social worker for the Yale Survivorship Clinic. I've actually been in the clinic a little over 8 years now, and I work in the Smilow Breast Center as well. So I'm looking forward to this evening, and thank you for joining us.
Thanks so much, Angela. Go ahead, Brian.
Hello, everyone. My name is Brian Jin. I'm one of the clinical social workers at Smilow Trumbull and Smilow Greenwich, and I'm very happy to be here.
All right, thanks everyone, appreciate that. And tonight we're going to be taking some questions from all of you here through our Zoom platform. You can type in your questions to the question and answer chat box that's available to you. You can type that in. We're going to answer your questions after the presentations, and the format will be, we're going to have 3 presentations from Dr. Feyen, Dr. Kilkiss, and Ed, talking a little bit about some of the topics related to holistic coping strategies for cancer survivors. And then after that, we'll answer as many questions as we can get to, and that'll take us right through the hour. All right, so without further ado, I'm going to pass the baton over to Dr. Feyen to kick things off.
Great, thanks very much, Jevin. I'm going to just take a second here and share my screen. I have some slides that I'll share with you all. Let's pull this up. Can everybody see that okay? Okay, great. So, right, as I said when introducing myself, I'm a psychologist at Smilow. I like to think of myself as a helpful resource for helping folks cope with the diagnosis of cancer and all that goes along with it. What I've prepared for tonight are some hopefully what I think are helpful tidbits around coping and maintaining resilience. So first of all, what I want to just emphasize is you're not alone in this whole experience. As you may know, there are over 17 million people in the United States right now who are living with a diagnosis of cancer. Almost 2 million people will be diagnosed this year, And unbelievably, by 2040, there'll be over 26 million cancer survivors. And sadly, almost 40% of us will be diagnosed with cancer at some point in our lifetime. So those are concerning numbers. And as you know, more than anybody else, the experience of cancer can certainly feel like an emotional roller coaster with so many ups and downs that can impact how you think about yourself, your life, your future. Can certainly challenge your ability to adapt to the changes in your life and to cope with them. It can be very difficult, but it can also foster growth in many unexpected ways. One of the things that I'm interested in as a faculty member is how people cope and how do we maintain resilience even when facing very serious illnesses like cancer. Now, let's just talk about resilience for a second. The American Psychological Association defines resilience as the process of adapting well in the face of adversity, bouncing back from difficult experiences. When I've asked some of my patients, what does resilience mean to you? They've said things like, well, feeling better or feeling more alive. Now, there's a whole science around resilience and trying to understand what helps people remain resilient in the face of extreme stressors. We're looking at the neurobiology of stress. And again, what are the brain mechanisms that involve adaptation and resilience to stress? And what we know, and from a very basic perspective, is that resilience reflects the work of many active and adaptive mechanisms that mainly have biological bases. But sparing you from the neurobiology, we can think of resilience, it's not something that you have or don't have. It's not a static property, it's very dynamic. It's something that can rise and fall depending on the circumstances in our lives. And it's also something that we can build and maintain through intentional, healthy habits. And so that's what I want to think about with you right now. What does resilience and the whole person mean? Well, when we think of the whole person and resilience, we're oftentimes thinking of these two basic dimensions, right? The physical dimensions and the emotional dimensions. You can add other dimensions to this, like the spiritual, the social. But what I'm going to focus on right now is mostly these two, physical and emotional dimensions, because they are so intricately related, right? How you feel physically has a huge impact on how you feel emotionally. And so when we think about resilience, we have to think about these two things. And a whole person approach, thinking about the physical dimensions of individuals' life, the emotional, the spiritual, and so forth, are what we're talking about. And good care, good whole person care has got to include attention to these qualities. And so I'm going to just take a minute and ask you a couple of questions, and you can send some answers in the chat if you like. What gives you strength in life? What helps you to bounce back from difficult circumstances? What helps you to feel better or more alive? Think about it. What gives you strength in life? What helps you bounce back? What helps you feel better, more alive? Anything coming through the chat, Javin?
Not right at the moment, but again, as Dr. Feyen mentioned, please feel free to type into the chat answers to these questions.
Yeah, let us know, and that's okay. You don't have to say anything.
Oh, got one right here.
Okay.
Miss Williams says my faith. Oh my gosh, there's a lot coming in now all at once. All right.
Good, let's hear them.
Maureen says my faith. Mary says my kids.
Kids.
Beverly says power of prayer for healing.
Faith again, prayer, yeah.
Janet says socializing with friends, family support.
Friends, family, yep.
Lindsay, sometimes just time.
Time, right.
Janet also says exercise.
Exercise,
I think that's a great one.
Good, right. You've got it. Oftentimes the things that give us strength are things that we do through action, like exercise, prayer, getting together with friends. But it can also mean things that we do mentally. And prayer is part of that, or meditation, patience, acceptance. And so what I'd like to do is to present to you a very basic 3-part model for building and maintaining resilience that kind of captures this holistic approach, where the first part of this model is around healthy lifestyle. Someone said exercise and friends. We'll talk more about that in just a second. The second part of this model relates to optimizing medical care and managing difficult symptoms that you may have. And the third part is around cultivating healthy habits of mind and heart, that heart quality that we want to live with. So let's talk about the first part for a second, healthy lifestyle. So what do I mean by that? What I mean by healthy lifestyle is those things that form the foundation for very good physical and mental health, right? Getting a good night's sleep, moving your body, exercising regularly, healthy diet, making time with family and friends, the capacity to accept help from others. These are sort of healthy lifestyle habits that we can develop and cultivate. And when there are problems in any of these areas, if someone's not eating well, if they're not sleeping, not getting sufficient exercise, not willing to accept health, it can affect your ability to maintain good physical and mental health, right? It can jeopardize your ability to manage stress. And so that brings us to the second part. Let's say someone isn't sleeping well, or someone has poorly controlled pain. We want to make sure that we're optimizing the medical care that you receive. Because again, good physical health is connected to good mental health. They're both connected. When we can reduce physical suffering, we can also reduce emotional suffering. So we want to make sure that if you have poorly controlled pain, nausea, fatigue, shortness of breath, that you're getting good care for that. But we also want to make sure that if you have other comorbid conditions like diabetes, heart disease, depression, anxiety, that you're getting the right care for those things as well. Because all of those affect physical health, physical functioning, and can have an impact on emotional well-being. So far in this model, we're talking about just general lifestyle, healthy habits, getting good medical care to reduce the physical suffering. And then the third part is what we can do through cultivating healthy habits of mind and heart. Now, these are the things that we can do that affect, well, that will relate to how we think, our attitudes. Cultivating an understanding of the relationship between our thoughts, our feelings, and behavior, because these things are all connected, which I'll talk about in just a second. But other healthy habits that I'll also touch base on in a minute relate to the idea of mindfulness, acceptance, compassion, flexibility, and knowing how to cope based on the situation, and also attention to one's values and what is meaningful for them in life. Now, there's a very basic principle in psychology, and it's based on this idea that our thoughts, our feelings, and our behavior, they're all connected. How we think, how we act, these things shape how we feel. I mean, imagine the thoughts that you have in your head have a huge impact on how you feel. So if we want to reduce the feelings of anxiety or depression or stress, it makes sense to think about how are we thinking? What are the attitudes we're bringing to the situation? What healthy, constructive, helpful attitudes can we adopt in life that help us to be more resilient and have a better sense of well-being, as well as what kind of behaviors can we adopt that help in these regards. Now, mindfulness is a very old concept, right? It goes back thousands of years, but it's become a very popular concept in part because of people like Jon Kabat-Zinn. And for those, many of you are probably already aware of this, but for those who aren't aware, mindfulness refers to being in the moment and an awareness of the present moment. It involves adopting an attitude of non-judgmental acceptance. So it's being here, Many times in life, we're thinking about the future. What's going to happen then? What if this? What if that? Or we're thinking about the past, the things that have already occurred. Very little time is spent in this moment, if we think about it. And when we're trying to manage the uncertainties of the future or the events of the past, any stress related to the past or future, we can bring ourselves back to the present as a way of managing some of that stress. So mindfulness is a really helpful idea. But also, we want to get good at, well, understanding what are the sources of stress in our life and know what strategies are best aligned with the type of stressor that we're experiencing. So for instance, in life, in any stressful event, there are controllable or uncontrollable aspects of a problem, right? I mean, cancer is a great example of that. There are some things that you can do to control your situation, but there are lots of aspects of it that we just can't fully control. So if a stressor was within your control, if there's aspects of a problem that are in your control, you're better off figuring out how to solve that problem, right? So we want to use what we call problem-focused coping strategies, gathering information, making decisions, resolving conflicts, setting goals, getting help, things like that, concrete, constructive efforts to solve the problem. But what if a stressor has elements that are not controllable, that are beyond your control? Those problem-focused strategies aren't going to work, right? Because you can't solve the problem. It's not in your control. So the next best thing that we can do is change how we think about the problem. If we can think about the problem differently, it can have an impact, a good impact on how we feel about the problem. So this is what we refer to as emotion-focused coping, like rethinking the situation, acceptance, accepting what is. When we can accept what is in life, we often suffer less. Getting support, exercising, meditating, these are all other examples to help us cope with problems that are beyond our control. But flexibility really is the key here, to be able to shift gears depending on the situation and within yourself, recognizing, well, this isn't in my control. I have to stop trying to fix it and switch gears. And finally, I want to bring our attention just to the importance of meaning and purpose in life. We have just this one life. What's most important to you in your life? What are your deepest values and beliefs? What is the purpose of your life? And what are the things that are most meaningful for you? When we can stay connected to the sources of meaning, to the things that are purposeful, it makes a huge difference in life, right? It's when we get disconnected from them where problems can arise. So I'll come back to those three questions again. What gives you strength? What helps you bounce back? What helps you to feel better and more alive? These are things that we do through action, like maintaining healthy lifestyle, exercise, and so forth. Things that we do mentally, the healthy habits of mind and heart, that's the prayer, the patience, the flexibility, and things that you can do to maintain your health, like staying on top of all of your medical issues and talking to your doctor. So I hope these principles are helpful to you. And I think the other speakers and panelists tonight will all connect to some of these things, and I hope we can talk more about them. So thank you very, very much.
Well, thanks so much, Dr. Feyen. That was really enlightening, I thought, to see how there are so many ways that we can act on, ways to cope with where we're at, through our own health, through our mindfulness, and really that mind-body connection. I think that's great to know. Angela, I saw you had, no, okay, never mind. Excuse that. These things happen when we're on Zoom. All right. Well, I just want to mention, some other answers to that question that you posed, Dr. Feyen. Faith and family, again, strength from time and fellowship at church. So again, faith,
Right.
exercise, making artwork, and then work itself, and diving back into work.
That's
So I
right.
think those were all some really great answers.
That's right. And the faith, you can have that wherever you are, right? It's always with you. That's the beauty of faith.
All right, and I just want to remind everyone before we get into the next presentation here, feel free to submit questions. We're going to get to them all at the end as best we can. And Dr. Kilkiss, with that, I will turn it over to you.
Thank you. And thank you, Dr. Feyen, for your presentation. I'm so pleased that I really think we're going to be sending a unified message here between the three of our presentations, which I think is actually a really positive thing. It helps to hear that from the experts. So these are things that are helpful, and these are things that do work. Dr. Feyen gave just a brief description of what he does at Yale, and I'll do the same. I primarily work with patients throughout their diagnosis and treatment, and even into survivorship years after treatment is complete for psychotherapy, and helping people learn tools to help manage both the emotional aspects of cancer and the physical aspects as well. And I did want to answer one question I saw in the chat, because I think it's an important one, and I want to make sure that everyone feels like these things apply to them. Was that the question of how do we define survivor? And generally speaking, when we're talking about a cancer survivor, we're talking about someone who's been diagnosed with cancer, and from that point forward. And so regardless of how many years it was after you completed your treatment, you're still considered a survivor. I know that's not a term that fits for everyone, but it's hard to describe a pretty huge, diverse group of people with just one word. And I think that's the best we've got so far, and we'll continue working on finding what that how that fits for everyone. So I wanted to target a couple of common myths that I hear often when I'm working with people, either because they say them themselves or they hear them from other people in their lives. And so I just chose two of the most common myths that I hear. I'll go over the facts of what we actually know about in contrast to these myths, and then some things that you can try to do instead of having these kinds of thoughts rolling around in your mind if they're not helpful. So the first here is that you need a positive attitude to beat cancer. I hear this actually quite a lot. Or sort of the alternative version of that is that if you're feeling scared, if you're angry, if you're depressed, if you're thinking, why me, then your cancer won't go away, or that it'll come back, that somehow your treatment won't work if you're having these, what I would consider very reasonable and human responses to a very challenging situation. So I'm going to bust that myth and say that actually what we know is there isn't any evidence at all that having a positive attitude improves your chances of your treatment working, prevents recurrence, or prevents death from happening from cancer. And there's actually been quite a bit of work done on this, probably about 20 or 30 years ago. Researchers got really interested in personality and how personality influences cancer response and cancer recurrence. And what we found is really we don't have a lot to go on. What we do know is that pushing down feelings, avoiding them, suppressing them, or denying our feelings can backfire and can make it hard to cope in the long run. So even if it may not influence your cancer trajectory, it will certainly make life harder in the meantime. And I just put that quote there by Carl Jung, one of the founders of psychology, to just point this out, that what you resist persists. So we know that usually the harder you try not to think about something, or the more you try to shove down your emotions, maybe shove them into a closet, the more actually it will keep coming around, because we're actually sending a signal to our brain that this is important, you need to think about this. So it doesn't usually work the way that we intended to. Okay, so what do we do instead? We have done something here. Okay, all right. So the first is one to just acknowledge and accept that, I think I've done something funny with my, oh, okay, I got it. Technology is not my strong suit. You might have caught on to that. Okay, so instead, Dr. Feyen talked about this, the idea of acknowledging and accepting how you feel, which isn't an automatic process. You don't just suddenly one day you wake up and realize that, oh, I need to pay attention to how I feel and be okay with it. It's something that you can learn to do more effectively over time. But part of how we do that is to start talking to ourselves about how we feel and start challenging these ideas we have in our minds that just simply aren't true, that the fact that we struggle with difficult things is human. There are no superheroes. They're not real. We're humans. We have human emotions. We respond to things in a way that reflect that. And our emotions are often communicating something to us, and they're important to pay attention to. And Dr. Feyen also mentioned the idea of mindfulness, and that's one of the ways that we start paying attention and getting better at recognizing what our emotions are in response to certain situations and what our go-to habits are in responding to those, whether those are effective or ineffective. A lot of times we're so busy and so caught up in stress and things that we have to do that we don't often slow down and actually pay attention to how we feel. And so it's hard to know what to do about our feelings if we're not aware of them. And maybe sometimes that comes out in different ways, like, flip off somebody on the interstate when we're driving because they've cut us off, or maybe we snap at a spouse or at our child, or something like that, or maybe we start to have physical effects from suppressing our emotions. Like, it's not uncommon to have some stomach troubles if we're feeling upset chronically. And so to avoid things getting to that point, we can get better at recognizing those things as they start to pile up by giving ourselves a chance to pause every now and then and just check in with ourselves. And I put this idea of observe, describe, and participate down here because it's sort of a quick and dirty way to start practicing mindfulness. One, we observe what's going on around us. That could be internally, that could be externally. Describing, labeling that with words, maybe describing how it feels in our body or our reactions to it. And then once we feel like we've gotten a good handle on what is here, if it's not helpful to stay here, like Dr. Feyen mentioned, if it's not a solvable problem, if it's no longer helpful for us to keep returning to what we're thinking about, then shift to participating in something, do something that we can throw ourselves fully into and try to be as present as we possibly can. And again, I realize I'm making this sound really easy, and it's not. It takes a lot of practice, and maybe it just starts with 20 seconds at a time, just sitting quietly for 20 seconds, because how often is it that we're getting distracted by things around us, like our phones buzzing at us, our emails chirping at us, somebody needs our attention. And very often, even when we're doing things like eating, we're also doing something else at the same time. So I would challenge everyone here today to find a minute or two and if we have time, perhaps we can come back around and try that at some point throughout the presentation. Just take a minute or 30 seconds just to be still and notice what we notice. But that's where you start, is starting to pay attention to what's going on inside of you and outside of you. Okay, what to do instead of stuffing it? Get it out somehow. It doesn't have to be, if you don't have people in your life that you feel like are good supports, if you've have a dog or a cat that you can talk to, if there's a support group that you feel like could be helpful, you could get a therapist, you could start an anonymous blog, you could journal and then tear it up or burn it. There are all different ways to get your emotions out without necessarily needing to tell anyone about it if it feels like it's too private or that people won't understand. Oftentimes cancer can be a pretty isolating experience when you're the one going through it. And even though there might be other people who have some idea of what that's like, your experience of it is your own. And sometimes it's helpful just to talk to yourself about that. You can also do this, some of the things that have been mentioned before, doing some breathing exercises. Slowing down your breathing is a quick way to get your body to calm and your mind to calm. Having a hot bath, having a nap, going for a walk, visiting a friend, lots of different ideas of what this could look like, and you can tailor them according to what works best for you and where you are in your treatment. So if you are struggling with nausea, if you're feeling exhausted, maybe you're not going to go for a hike. Maybe there's something a little more low key that you could try. And if you're one of those people that looks at me perplexed when I ask them what they do to relax, then maybe these other strategies could be helpful. Maybe you could clean the house or clear out a cupboard or pay some bills, cross some of those things off the to-do list if that's something that helps you feel like it takes your mind off things and helps you feel accomplished. It's both and. And I often hear when I ask people what they do to cope or to occupy their time, they tell me about tasks. And so with Dr. Feyen's questions of what actually makes you feel more alive, maybe less bill paying, but if that's your thing and that's what makes you feel really good, do that. Great. No judgment here. So second myth, the idea that if I'm struggling, I must be weak, or there's something wrong, I should be stronger. Or the alternative version of this that I often hear is that needing help means that I've failed. And again, that's just simply not true. And the reason why I know that for a fact not to be true is that what our research tells us about people who have been diagnosed with cancer is that almost half have significant distress following diagnosis and treatment. And distress is sort of a catch-all word. And what that means is that we're having trouble, some kind of emotion in response to the diagnosis. It doesn't have to be to the level of a depressive disorder or an anxiety disorder, but that's still nearly half of people who are really feeling like their lives have been interrupted by this. And so you are not alone in that. And it's actually probably more common than you're going to find people that know what you're talking about when you talk about this being impactful than not. And it is true that people who've been diagnosed with cancer are at higher risk for anxiety and depressive disorders than the rest of the general population of people who have not been diagnosed with cancer. Nearly half or over half of patients are prescribed a psychiatric medication during their treatment. And that we know that it is extremely common for patients to struggle with insomnia, fatigue, and pain, sometimes even well beyond when treatment is completed. So you're in good company if you're having a hard time. So it doesn't mean you're weak. It means that you are dealing with a life-threatening illness that is requiring you to engage in toxic, expensive treatments over a long period of time. And you've had this big thing dropped in your lap that is screwing everything up. So of course you would have a response to that. And of course you would have difficulty managing that. So what do we do instead? Ask for, and I would also say, and accept help. I know depending on where people are in their treatment at their diagnosis, they may not know what they need for help. It may take some time before you realize that. And it's okay to ask again. And to be specific about what it is you need. Some people in your life might think it's helpful to come over and watch your kids, when really what you might want them to do is to cook a meal for you, take out the garbage, clean the house for you. Also know your audience. So if you've had the experience maybe of asking for help before and it hasn't gone well, there could be lots of reasons for that. But one could be maybe the people you're asking aren't great at the type of help that you need. Some people are better at emotional help. Other people are better at practical help. And some people aren't great at continuing to ask if you need help. So you might need to reach out to them as well. And very often, it seems to be that people experience that there's more help than they realized when they ask. And it maybe comes from sources that they wouldn't have expected. And so it can be surprising where the help comes from. You can also outsource the help. So your treatment team are wonderful social workers. The people who have been working in cancer for a long time hear about different organizations and different avenues for getting help that you may not be aware exist. So you don't have to just stick with the people that you know. You can reach out and ask for help with people that you don't know as well. What to do instead, talk to yourself, but be better at it. So we tend to be really critical of ourselves and say things to ourselves that we would never say to somebody else. I even catch myself doing this, and I'll drop something and say, "You idiot." I would never say that to my partner. If he dropped something, I would say, "Oh, don't worry about it. It's not a big deal." Why do I say it to myself? It's not very kind, and it certainly doesn't help the situation. In fact, it might actually make me feel worse. But we also want to be careful here and not go towards, so we want to be somewhere in between Pollyanna and drill sergeant. So we don't want to be really harsh on ourselves, but neither do we want to be excessively positive to the point where we don't even buy what we're telling ourselves. We're somewhere in the middle, little engine that could. I can do this. I'm stronger than I think. I'm okay right now. Right now, I'm safe. Right now, I'm healthy. My mind isn't always my friend. Just a reminder that sometimes our minds can play tricks on us and tell us things that aren't necessarily true and can be really unhelpful. And lastly, practicing self-compassion. I mentioned an instance where I wasn't being very compassionate towards myself. So what that looks like simply is being as kind to yourself as you would be to other people. This little cartoon here says, they said, treat someone like you love yourself. And the little guy says, don't forget to treat yourself like someone you love too, especially right now, especially when you are the most challenged is when you need to draw on the most compassion for yourself and kindness for yourself. It also means that that might be the time when it's hardest. And so you might have to dig deep and be intentional about being kind to yourself. Okay, this is my last slide. These are just some resources to help you get started on doing some of these things. If it helps to take a screenshot, I know that these are being recorded and being placed online, so you can also find them there. There's some apps to help you get started practice with mindfulness, with breathing exercises. Almost all of these things are free. If they're not, they at least have a trial period that you can start. There's also some websites here for resources for mental health, for task and financial resources, and for peer support as well. So there are some really great organizations that will connect you with somebody with a similar diagnosis and treatment to you, and you can talk to them, and it's free. So thank you so much, and I don't want to take any more time. Let Ed move on from here. Thanks so much.
Thanks so much, Dr. Kilkiss. Appreciate that. And yeah, I feel like I learned a lot from that. And I love that graphic you had at the end with the elephant and the fox, and making sure that you love yourself too. And I know it's something we hear so much from the people we see in the clinic. That concern they have with they're the caregiver for so long for their loved ones, and then having to transition and be the one that's cared for.
Absolutely. I meant to mention that this may be the first time you've not been the helper and you're needing the help, and that can be hard. So be compassionate with yourself around that too. Yeah,
I love that. I wanted to mention Joseph said in the chat other ways of coping. He said, I found doing volunteer work in service to others helps coping. I think that's wonderful. All right. So just quickly before we get on to Ed, I will post the website for everyone where you can find the recording of this Smilow Share session tonight. It'll also be where all of the recordings are and all of the wonderful videos and content we've been posting all month long, and will continue to through the remainder of this week. That website will never go away. It will always be there for access. There'll be resources to celebrate survivors this month and beyond. So Ed, without further ado, and certainly last but not least, I will pass it along to you. You able to share the screen on your end?
I'm going to give it my best shot.
If not, I have it ready to go too, and you can just tell me when to click through.
You do. Okay. Let's see. Let's see. I don't.
All right.
Okay.
I'm going to share the screen, and then you can just tell me when to forward ahead. Just say next or whatever works best.
Okay.
So bear with me just a second.
Sure.
Okay. All right. Does this look familiar?
It looks very familiar. Yes.
Okay.
Like mine.
Great.
Yes.
There we go.
Okay. All right. So what you heard some really important information from Dr. Feyen and from Dr. Kilkiss. And for the first part of what I'm going to be presenting, I'm going to switch gears just a little bit. I've got a sense that many of you in survivorship may have gone through the palliative care clinic, possibly. I mean, I'm not going to guarantee that, but there's probably a sizable number of you who have. And I just wanted to cover some of the myths versus some of the facts regarding palliative care. Devin, you can hit the, okay. So a question for everybody, and I'll give you time to think about it. What comes to mind when you hear the words palliative care? And I found this piece of clip art, which I found was rather interesting because it kind of represents really all this sort of crazy, sort of conglomeration of different words and phrases that people think of when they think of palliative care. Some are accurate, some are not. So I'd be interested to hear what some of your thoughts are, just quickly.
I'm going to quickly stop the share here while I open the chat up.
Oh, okay, sorry.
No problem.
Okay.
We'll give people a few moments, and feel free again to enter into the chat some thoughts of what you think of when you hear palliative care. So some people saying here, might die soon, pain management and comfort, no family to care for you, end of life care, care during hospice, end of life care.
So those are all very interesting and very representational of what many people think of when they hear the term palliative care.
Another one, add post-treatment symptom management.
Okay, which is more along the lines of being accurate. That's it is the big myth is that we're dealing with people who are dying all the time, and that we're speaking to people about end of life constantly. That is far from what we do. In fact, if we could go back to the slides, we can. Okay.
Right here.
So I'm going to clarify a little bit about some of those misconceptions. It seems like the majority of you do have that sense that we are dealing with end of life care most of the time. The word palliative is used interchangeably within the palliative care. Within palliative care and within hospice care. All palliative means is comfort. In terms of what we do in palliative care, yes, we are dealing in comfort care, but we're doing that in a way that we're trying to alleviate the cancer pain, and that doesn't mean that you're no longer in treatment. It just means that you've got discomfort due to your disease and you need another level of support, something that's going to help you through that period of uncomfortable pain and those feelings. Hospice, on the other hand, it's used for there because that's what they do. They're doing palliative treatment really to keep you comfortable through the end of your life. And it's a necessary piece of care, but it's the opposite of really what the palliative care team does overall. So if you can, Javin, go to the next slide. Okay, so what is palliative care? So the overarching mission of palliative care is to aid people with serious illnesses such as cancer to feel better. It accomplishes this by providing a holistic approach to treating the physical and emotional symptoms that arise from the effects of disease and its various treatments. Approaching the needs of patients and families through a combination of pain management, psychosocial, and spiritual interventions, the ultimate goal is to lead the person being treated and those caregiving toward an improved quality of life. And I think, that I articulate it better in my printed word than I do verbally, but that is pretty much what I feel should be the clear message of what palliative care is. There's more. Can you continue, Javin? Thank you. Palliative care in its most advantageous form is a collaborative interaction among members of the medical and oncology teams. That includes physicians, APRNs, NPs, PAs, and RNs, and the ancillary disciplines, including social work, psychology, spiritual care, art therapy, and integrative medicine, which we make use of all of those. And again, it's a holistic approach. We all recognize our strengths, which is very important. There's hierarchy, obviously, in most teams, but in palliative care, we all recognize our strengths, and everybody is respected for what we provide to our patients and their families. And the other piece of this is that it should be encouraged, the idea of palliative care should be encouraged as an option to patients and families, if at all possible, when the illness is diagnosed. And this is a pet, it's a pet peeve, but it's also a pet, it's also a very fundamental thing that I think is very, very important. I don't think it's, the pet peeve part comes from the fact that I don't think it's explored enough at the time of diagnosis. And I really think it's an important thing, and it should be something that's, that the medical community should probably look a little bit more in depth about, because it will aid individuals to overcome any fears or misconceptions they have and make it for an easier, more educated decision, and ultimately more able to accept what palliative care has to offer. It is important to remember that the service is available throughout curative treatments, during follow-up, and if needed, as a bridge to hospice at the end of life. That being said, palliative care is not a should, but a choice. And I just want to go back to that piece about it being a bridge to hospice at the end of life. That's a very important piece, but again, it's a small piece. As one of the doctors I work with has explained to patients at times, palliative care is a very sort of large sort of circle. And within that, there's this tiny circle called hospice care. And that's an important thing to realize. So, so again, when we're talking about end of life, it's a small piece. And next slide, Javin. And most of all, palliative care is about helping patients and families live in a more productive environment, focused on living, and explore ways to find meaning in their lives. So that's the basic underlying message of really what palliative care is. We talk so much more about life than we do about death. And I think that's an important piece. Given that, as that we do explore ways to find meaning in their lives, I'm going to make up I'm going to go to the next slide and talk about something called meaning-centered psychotherapy.
Ed, this is Dwayne. Before you do that, a question came in
Sure.
from one of the attendees.
Sure.
Does insurance generally cover the cost of palliative care from the time of diagnosis?
Yes, it does. As long as there is a referral made to the palliative care team, it is part of it will be covered by your insurance. Not an issue. It's just a matter of your doctor making that referral. It's pretty basic, pretty simple.
Thank you.
Yeah, thank you. Thanks for that question. So, meaning-centered psychotherapy. One of the ways patients and caregivers may be guided in finding meaning in their lives is through a therapeutic intervention originally developed for patients who are in advanced and/or active cancer treatment. Next slide. And the concept of meaning-centered psychotherapy was started by this guy, William Breitbart, Dr. William Breitbart, who is a psychiatrist and author. He's head of psychiatry at Memorial Sloan Kettering, and he is the creator of meaning-centered psychotherapy. And just to read a quote of his that he wrote as a forward to a manual, he wrote, "Creative sources of meaning are especially important resources for patients in despair. I have thought of creative sources of meaning as including the aspects, values, efforts, creative processes, etc., that go into the process of discovering your life. And that's a primary tenet of what really meaning-centered psychotherapy is about. Next slide. I don't want to take too much time. And this guy is Dr. Viktor Frankl, and he is the person who Dr. Breitbart based a good portion of his therapy, his meaning-centered psychotherapy on. He's a psychiatrist, was a philosopher, an author, and a Holocaust survivor, and a creator of something called logotherapy, which is something that meaning-centered psychotherapy takes a great deal from in terms of its philosophy. And I'll just read what he wrote from his classic book, Man's Search for Meaning. We must never forget that we may also find meaning in life, even when confronted with a hopeless situation, when facing a fate that cannot be changed. For what then matters is to bear witness to the uniquely human potential at its best, which is to transform a personal tragedy into triumph, to turn one's predicament into a human achievement. When we are no longer able to change a situation, just think of an incurable disease such as an inoperable cancer. We are challenged to change ourselves. I'm not going to really try to explain what Dr. Frankl says. I think it's everybody can interpret it for themselves, and I think it's pretty clear. If people as to what you think it means. Next slide. So what is meaning-centered psychotherapy? Its purpose: to affirm the possibility of experience and creation of meaning, even in the face of advanced cancer and potentially limited prognoses. It has been expanded to be used in a variety of settings. Whoops. Oh, thanks, gentlemen. It has been expanded to be used in a variety of settings. People with terminal illnesses, caregivers, bereavement groups, substance use disorder groups, and even the medical workplace for employees. To aid participants in their discovery, reconnection, maintenance, and even enhancement of a sense of meaning in their life, and to facilitate greater understanding of meaning. I also just want to add that when I use this with patients, I use it as I do it in group form, and I also do it individually with individuals. I've even used it to help couples, especially people who are having a difficult time finding meaning together as a couple, and being able to sort of broach the topics that are so hard to come by. And that sometimes does cover end of life, because sometimes it's a topic that people don't necessarily share with one another until it's much later in the in the process. So it's been helpful that way. People have been able to sort of confront that and talk about it in a much more open way. I've had people talk about the fact that they will, after one session, they will talk for the next week about that session, what's coming up and what's going to be coming up for the next session, and have all their questions and homework ready to be to talk about, which is pretty amazing and pretty awesome when you think about it, that they're able to do that. And I'm not taking credit for that. This is all about this therapy. It's pretty amazing. People really do connect in group. Even in fact, after maybe the first session, you will see how people in just this in the course of an hour to an hour and a half, how much they have connected with one another, and can't wait for the next session. So next. So, he who has a why to live can bear with almost any how. And that's Friedrich Nietzsche, for people who aren't familiar with that phrase. But if it's very important to remember that we all have reasons to live. Even if we think the scope of our lives are shrinking, there's always new ways of finding hope and finding new things to discover about ourselves that we may not have discovered before. So you're always in a place where you can, I think, discover something new about who you are and how you want to continue producing legacy and living a legacy. So next. So the last thing I'm leaving everybody is, what does meaning mean to you? And I think Dr. Feyen had sort of asked that question at the beginning of his talk, and I want people to continue thinking about what it means to you, and maybe even if you'd like to. I know it's a lot to ask of people to share something maybe as intimate as what meaning means to them in a large group, but if you're willing to, please do. So, and I want to thank you all, and thank you all for your patience. Thanks. Okay.
Thanks, Ed. I'm going to go ahead and stop the share so everyone can see us again. That was great. And yeah, I want to invite everyone. I know we're just over the hour here at 8:01. We're going to go a little bit longer here. We also want to be mindful of everyone's time, though, and understand that if you have to get off, I'm going to go ahead now and post the link for the website where you can find this presentation, the whole Smilow share session, as well as other content from the month there. So everyone can use that link to go to after this is done and see this whole presentation. It'll go all the way through until we're done here, if you can't stay with us. But going back to Ed's question, what does meaning mean to you? And if anyone wants to chime in the chat, we can do that. And then I saw a few other questions that came in as well. We can answer after that. And if you have questions in general too, feel free to type that in. So what does meaning mean to you? Ed, go ahead. You were going to say something. I'm sorry.
I was just going to say something because I see that Elizabeth left a question in the Q&A that asked, that said, I was not offered palliative care and had to figure out a lot on my own. The only time I have seen palliative care offered is just prior to hospice. How can we better inform patients on palliative care? Excellent question. And I wish I had a definitive answer, other than the fact that if in a perfect world, I would love to sort of just to collect all the oncology teams and just educate them, because this is not to badmouth anybody, but I have heard from plenty of patients say that they have heard from oncologists when they have asked about palliative care, you're not ready for that yet. And so there is quite a divide there, and people, and how do we fill that? Is just by educating and educating as much as we can. I mean, that's about what it comes down to. Any chance you get. And if you really feel that you want, and I've had patients do this, they've seen our flyer. If they really want to be if they do want the services of palliative care, ask your provider, and know that your provider, all your provider has to do is request a referral to us, and your chart will come through to us. We'll take the team will take a look at it and give a yes or no, and in most cases it's a yes. It's always worth asking. I mean, and advocating for yourself. I mean, I think that's the big message. So, yeah.
Oh, that's a great point, Ed. And to that point, as a physician assistant myself, it's so important for us to have that education as providers as to what palliative care actually offers for our patients and when we should be referring people to palliative care. And I would agree and second your message, Ed. If you're working with your oncology team, your care team, and you feel that you would want palliative care services or have questions about it, I would encourage you to ask your provider. Ask them about it and what can be offered for you.
Mhm. Thanks, Jeff.
Yeah, absolutely.
There's another question from Janet, and she asked, how can someone find a meaning-centered psychotherapy group? So, and Jen, I'm assuming that you're obviously part of Survivorship. So I'm going to ask Angela to speak to that because she's the one who runs the Survivorship meaning-centered group. I think you still do, right, Angela? I mean,
Well, prior to COVID, yes. Actually, no. In all seriousness, prior to COVID, I was regularly facilitating a meaning-centered psychotherapy group for cancer survivors. And the group itself runs about 7 to 8 consecutive weeks. And we like to keep the group very small, usually 4 to 6 or 7 people, because it's very in-depth and it's a lot of processing and there's homework involved and so forth. I'm hoping now that things have started to open up more that I'm going to be able to start another meaning-centered psychotherapy group for survivors. So if you are interested, I do work at the New Haven Smilow location. You're welcome to email me your name and contact information and I put you on my waiting list. And my hope is to possibly have something start up again in the fall. So my email is angela.parala@ynhh.org. And actually my direct telephone number is 203-200-6360. So I'd love to have you participate. And I know that Ed himself was also facilitating meaning-centered groups for more end-of-life care. Is that correct?
Exactly. For people with advanced and active
right
cancers. So, and still doing that, I co-facilitate that with our senior APRN on the palliative care team, Leslie Blatt. So, and we try to make that as consistent as possible. After each 8-week session, we'll take a 2 to 4 week hiatus just to recruit new people for the group. It's 8 sessions long, 8 straight Wednesdays in our case, for about an hour to an hour. It's about an hour and a half each session, and we are always looking out for people who want to participate. So that's so thank you for your.
I just want to add that Smilow is really undertaking a big project to expand a lot of their offerings. And part of what I'm advocating for is more groups like meaning-centered psychotherapy being offered across disease sites and into as many people as we can reach them. And Smilow is also undergoing sort of a big push to make it more clear to patients what is offered, when, how to access it, because a lot of these things, I even find it difficult to find sometimes, and I have all the terms and things that I know to search and still can't find it at times. So there will be some changes coming soon where not only more will be offered, but it will be easier to find.
Great, that's great.
Yeah, that's really good to know, especially such a big system. It's not easy, especially for those looking in. We had another question come up in the chat a little bit earlier, and I did want to make sure we got to it. Mary says, I sometimes find it hard to have self-love when the person in the mirror is so different and, in quotes, less than what you were. How do we continue to find that self-love? It's a great question.
And I bet we all have something to say about it. So I'm going to take a back seat because my instinct is to jump in and talk a lot. So I'll let somebody else.
I'll start, but I'll ask my colleagues to jump in too. Mary, that's something that a lot of people struggle with. You're not alone in that question or that feeling. A lot of people feel like their whole life has changed as a result of cancer in all kinds of ways, physically and other ways. I think it takes time. I think it takes some patience in examining what you do have, and looking less at what you may not continue to have. I mentioned the importance of flexibility before. There was a French philosopher, and Ed and Angela probably know who I'm going to refer to because it comes up in the meaning-centered therapy. His name was Jacques Derrida, and he wrote about that there are ways of being in this world and ways of doing in this world. Cancer is one of those things that affect our ability to do certain things sometimes. We can't jog or swim, or our lives have changed that affect how we do things. But we still have a core way of being in this world. And so I think, to answer your question, sometimes it comes back to reconnecting with that core part of yourself. And to Ed's point about meaning, reconnecting to the things that are meaningful in your life, whether it's your faith or your family or nature, art, those things that connect to your core. So I think that's one way to start, at least.
And if I could just add to what Dr. Feyen so eloquently described, I had a cancer survivor once tell me that cancer is a comma in her life, and that she's so much more than that. She's a daughter, she's a friend, she's a sister, she's a mom, whatever she did for a living. And so again, it's thinking within you and thinking about what brings purpose and meaning to your life, and going deep, like what Dr. Feyen said, to that core, and really thinking about those things that bring that meaning, to your life. And I would just encourage you to do that.
Yeah, and I would just second what Dr. Feyen and Angela both said. I think, remember that you are not your disease. That's not who you are. Remember, you were somebody before your disease, and you continue to be that person. You may not look, you may not feel exactly the way you always have, but underneath, and as Dr. Feyen said, if you go deep enough, you'll realize that you are still very much that person, and you're entitled to tell people that you're still that person, and show that you're still that person. So.
Dr. Feyen mentioned John Kabat-Zinn, who is a teacher and researcher of mindfulness. And in one of the meditation exercises he does that I really like is called a mountain meditation. And the idea being that we imagine that we're the mountain, or, we're solid, we're immovable. And then he guides us through how the seasons change. Tourists come on the mountain when it's beautiful outside and there's no clouds in the sky, and they comment on how beautiful the mountain is. And then the winter comes and they're complaining about how cold it is and it's windy and there aren't any nice leaves. And so all these things around the mountain change over time and over circumstance, but the mountain itself is unchanged. And I really like that image because I think it speaks to what everyone has mentioned, which is that there are parts of us that we hold on to even in the midst of some of our most tragic circumstances. And it is so normal and human and absolutely the way our brains work to focus on the change and what we've lost. But it doesn't have to be either or, it can be a both and. We can both grieve what we've lost and also look toward who we still are, or maybe the changes that we want to make or who we want to be moving forward, because it can also be an opportunity to do things differently. Doesn't have to be though. As I have a patient who just told me last week, I don't want cancer to change me. I don't want to find meaning in it. I don't want to have this big spiritual awakening. I just want to get through it. And that's okay too.
I think that's a great point, Dr. Kilkiss, is that on a broader level, it's an individualized path or an individualized journey, and people discover what works best for them. And it kind of goes back to some of those myths too that you mentioned, where it's you're told, oh, this is the best way to do something. Well, the best way is your way and what works best for you, and that's what has been a theme that I see working in the survivorship clinic. All right, so we're getting a few people chiming in the chat here, just saying thank you for all of the information, finding it very helpful, the source of information and the presenters. And we have people who have come back for multiple sessions, maybe even all four, who have thanked us for that over the weeks. And I want to encourage people to continue to ask questions, if there's anything else left on the table that maybe we didn't get to. But with that, I know we're over the 8 o'clock hour, and we've extended a bit further. I want to take a moment to thank everyone here again for taking the time, our panelists and our presenters, for joining us throughout all of the sessions, and obviously tonight as well. And then on top of that, I want to shout out to the whole survivorship program and Smilow network as well. Everyone who made this possible. Special shout out to Heather Studwell, the survivorship coordinator down in Greenwich, who helped make this very much possible as well. And Dr. Tara Samft, who is the medical director of the survivorship program at Yale. First and foremost, though, it wouldn't be possible without everyone here joining us tonight, this evening, taking time out of their own busy schedules, and doing for their loved ones and for themselves to learn more and to be engaged in their own care. I think that's so important, and I give all of you all the credit. You're also inspirational, and that's what this month is about. That's what National Survivors Day is about. It's about celebrating all of you and coming together to do so, and maybe learning a few things along the way, and also having fun. So thank you all for that. I did post the website again. It's https://www.yalecancercenter.org/patient/specialty/CSD2021. It's a mouthful, but I posted it there in the chat for all of you too. You can also just Google Yale Survivorship and go to the Yale Survivorship website that comes up. It's the first link that appears. Click on the link that says learn more about our National Cancer Survivors Day celebration. This video will be posted there, as well as all the Smilow Share sessions. You've tuned in tonight for Smilow Shares, Holistic Coping Strategies for Cancer Survivors. We heard from some wonderful presenters here, Dr. Feyen, Dr. Kilkiss, and Ed. Our panelists, Angela Kerala and Brian Jin, were here. Brian had to log off a little bit early, but he was here as well. And thank you for the team behind the scenes, Eliza Folsom, Renee Gaudet, Emily Montemillo, and everyone making this possible throughout the month. And like I said, first and foremost, thanks to all of you. And happy National Cancer Survivors Day month. Enjoy your evening, everyone. Thanks. Take care.